The conversation this morning is still on patients and the healthcare system, especially in this part of the world. And Adia and I started the conversation. We gave tips. In fact, we took comments from people on how they've been treated in hospitals and how they have fared well. We got some people that said, okay, so they got very wonderful treatment from doctors and nurses and other professionals at the hospitals. And we also had people that complained very bitterly on how they were being treated and how the hospitals and the healthcare systems were very negligent on how they cared for them. So, and while we were having that conversation, a lot of questions came up, which we will now be directing to our guest this morning. We have Dr. Rehanatu Abu. She is here with us. She is the friend of the house. In fact, she's a doctor. She's our doctor. She's the doctor of the house this morning to break down this conversation with us. Good morning.
Good morning.
Thank you for coming.
Thank you very much.
See you again.
My pleasure.
Yes.
I know the last time we saw Dr. Rehanatu is when, so we had a conversation on BP, on blood pressure.
Yes.
And we thought, you know what, we should probably go get our BP checked. And then we met Dr. Rehanatu, and then she checked it for us. So thank you very much for that.
Yeah.
You're welcome.
Now, so let's move into the conversation properly. Now, what is the, what are patients' rights? When I'm going to the hospital as a patient, what should I expect from a typical hospital, from a primary healthcare system, from a doctor and a nurse? What are my rights?
Okay, so as a patient, when you visit a hospital, you certainly have your rights, you know, because as healthcare workers, we have a duty of care. We owe you that duty of care to ensure that we keep you safe, we take care of you, we make you feel better. So it's also your right to walk into the hospital and demand certain things. For example, you have an emergency, you come into the hospital, of course you have to be attended to. Once an establishment or an institution is designed to meet the health needs of people, we have to take care of these patients. So it's your duty to come in and, oh, I have this complaint, and for you to be attended to as well and attended to properly, so for you to get quality care. So if you're not getting that, then of course you can make complaints about that.
All right, so in a hospital, what are the safety and healthcare management systems that a hospital is supposed to have? You know, according to the Occupational Safety and Health Administration, there are actually particular things a medical facility is supposed to observe in their hospital. So what are these systems that are supposed to be in place?
So like every health and safety management system, you have certain elements that should be present. The first thing is for you to have a policy. There must be a health and safety policy in that healthcare system. A policy that addresses the aims and the objectives of the facility as regards patient management, patient safety, no matter how small the facility is, even if it's a community health center, even if it's a small clinic, you must have a policy. And this policy must be communicated to the healthcare workers. So everyone must be aware that, okay, this is what you're supposed to do when this particular thing happens. And also know that the key thing in the healthcare system is to ensure patient safety, ensure that you deliver quality care. Organization is another important aspect of the health and safety management system. You know, you have different units. For, say, tertiary institutions, you have various units. You know, roles and responsibilities must be outlined. Who is in charge of this? Who is in charge of this unit? Who should be reported to? What are the reporting lines like? You know, there must be supervision. You know, there must be trainings. You know, you must provide information, instructions to the healthcare workers. Very, very important. There must be a means to also evaluate medical errors. You know, you must constantly audit your healthcare system as well, too. Because you have, for example, like when I was working in a certain hospital, and most hospitals actually do this, there's something that we refer to as the morbidity and mortality review. So we have like a review of all of our patients for the month. So any patients that, died during the course of treatment or stayed longer than they were expected to stay in the hospital, then we review those patients. You have senior colleagues there asking questions, why did you do this? Why did this particular thing happen? So you must have like a check and balance system, there must be checks, monitoring,
accountability,
accountability, and all of that. So essentially, every health and safety management system should have this so that you can minimize medical errors in clinical practice.
Okay, let's talk about the option of money.
Okay.
Now, before you came on the show, Ade and I already had conversations with callers. We did a survey on, we asked people to share their experiences on how they've been treated in hospitals and how medical practitioners has also treated them. Okay. So there's a particular comment that described how a particular lady died because she did not get the care that she needed. And she had an emergency, but they were asking for money first. They were asking her to pay for card and all of these things. And I know that happens in hospitals generally.
Yes.
When you come there, the first thing they will ask is if you've been registered, if you have a card and whatnot. I've never really experienced that, but we see this in movies a lot. And we've established that movies sometimes are mirrors to society, although it might be exaggerated. But why do we see something like that where, the first thing that people ask for or medical practitioners ask for is money? And I've discussed this even before we came back on the show with you, that the Hippocratic oath that was sworn by every medical practitioner is to save lives first. So why is the conversation money first, or make a deposit before we go on with the surgery, or even after we're done with the surgery and you've not paid, we'd have to keep you there so you go and find the money? Why?
That's a very interesting question. When it comes to money, everybody wants money. Everybody needs money. Even the doctors need money.
Yes.
The nurses need money. The lab attendants need money as well too. You have to pay salaries. You have to purchase drugs, fluids, everything that a patient needs. So, yes, sometimes I've seen those kind of uproars on social media where people complain and they say, oh, I went to this hospital, they didn't attend to me and all. But what I know is mostly when you visit a hospital, if you have an emergency, you're usually attended to immediately. Yes. And most times people come with either a patient, relative, or something. So their relative can be attending to the money aspect. Oh, what do you need to do? Because you have to register. You have to get a folder. It's all part of the safe system in the healthcare facility. So you have to do all of those things. So when you have an emergency, a serious emergency, most hospitals will attend to you before requesting for money. It's very rare for you to say, hospitals say, oh, you do not have money. You have an emergency, we cannot attend to you. Because as you said, it's our duty to ensure that we save lives. In terms of surgeries and all, it's a whole lot of things. You're going to be on admission. You're going to have to stay on the bed space. We have to care for all of those things. Your feeding, what you take in, your fluids, your drugs, a whole lot of things have to be catered to. And of course, we need money for these things. So, it depends on how these things are communicated to the patient and how they are addressed. Of course, you might have few people who may act funny. I'll just say act funny,
Okay.
But still, generally speaking, a doctor is supposed to save lives, supposed to attend to patients before they start to request for money.
Right.
And yes, there are cases where you will have to keep patients in the wards before you really, for them to pay their money up or finish payments before they are released. If you release them, how will you find them? And you need the money because you want to be able to attend to other patients as well too. Yeah. So the money is very important. It's a very, very important part of the healthcare system.
So how do hospitals actually deal with that? So for instance, the hospital has attended to somebody who couldn't pay at the start of the surgery. They're done with the surgery now, and they still need to collect their money. How do hospitals deal with these kind of situations, and how can patients also negotiate with hospitals in these kind of situations?
Okay, so sometimes it's really tough for us as healthcare workers, because of course you'll be asked not to. It's actually a managerial thing. So a medical doctor that is attending to a particular patient might not be so concerned or fully involved with the financial aspects of the person's health, because you have someone that is actually attending to that. But still, sometimes you have the nurses come to tell you, or someone come to tell you that this patient has not paid fully, so we can't discharge the patient. It becomes a dilemma, because some patients actually do not have this money.
Yes. Yes.
So it's not like they do not want to pay; they want to feel better, but they just can't afford to pay for those services. So that's why sometimes you see people put up stuff on social media to solicit for financial support. What do they call these things that they...
The crowdfunding.
Yes, crowdfunding, GoFundMe
yeah.
and all that. So that's why those things are actually done. And sometimes they have to stay. Sometimes I've had patients that will stay for like a week, 2 weeks. They've not made payments and they are still in the hospital. But of course, we keep on counseling them, talking to them, asking them to speak to family members, friends that can help them. So I don't think any doctor would just be rude to a patient, because we understand that there are financial challenges and constraints when it comes to visiting a healthcare facility.
Okay. Sorry. So before we had you on the set, we're looking at safety tips. Safety tips in terms of how patients, safety tips patients can actually do, so that they can ensure that they are well prepared in time before a hospital visit and whatnot. What else can a patient do? What in your experience, how can a patient or a health customer, what things can a patient do in time to make your job easier, in helping and aiding help to them?
Okay, so most times, in fact, in general, patient safety is not just about the patient, it involves the healthcare workers as well.
Yeah.
In fact, the burden is on us to ensure that when the patients visit us, they are safe, and they are well attended to, and they get the best quality of care. But in terms of the patients now, what we expect of them is, to come into the hospital. Firstly, I always say this, and be honest. Because, most patients, they come into your consulting room and they're just talking, and they're not hitting the right notes. They're not telling you the right things. I was discussing on my social media, I think a few days ago. Yeah. So, you have patients that will walk into your consulting room. You ask them, you can see that they have chronic cough, and, cough that's been there for like a very long time. Oh, I've had this cough for like 2 years. So in your head, as a doctor, you're thinking of risk factors, or what would have put this patient at risk of having this type of cough? Why does this patient have this cough? You're then asking certain pertinent questions as regards that. So do you smoke cigarettes? Everybody just feels that if you ask that question, it's like you're already judging them. So I would say the first thing to do, what we expect of them when they visit the hospital, is for them to come in and be honest. Most times it's always good to come with a relative, with someone, because trust me, the healthcare system is one busy place, and some places are like very, very big. You have to walk to that particular place to go and make payments. You walk a distance to go and get your labs done, to pick up your drugs and all. So it's always good to have an assistant, because when you come in alone, especially when you have serious medical issues to be attended to, or you're probably not as strong, you are overwhelmed by everything. You're frustrated.
Yeah.
You are not happy. So obviously that's going to reflect in the way you also respond to your doctors as well. And whatever you tell us as doctors, that's what we'll do,
Sure.
So yes, so come with comfortable clothing as well too, just be comfortable when you're coming to the hospital. I mean, of course, try to hold some funds. Money is very essential, like, we've discussed. If you're coming to the hospital and you're a stable patient, of course, you would need to register. They will need to open the folder for you. So you can't come and just expect that they will not attend to you. They will just attend to you like that. without paying for certain things. So money too is something that's very important when you're visiting the healthcare facility.
Okay.
We need to mention that we have a lot of medical practitioners that are doing their jobs and they're doing well, and kudos to every one of you.
Thank you.
And
because I'm sure I'm one of them.
Yes, you
are. Big ups to every one of you, especially frontliners during this pandemic.
Oh my God.
That it's been a whole lot. We've heard so much. We've had a lot of people risk their lives to do certain things.
Some doctors have died.
Yes.
Died, yes. Healthcare workers in general.
And we really appreciate this. I would just want to use the opportunity to say thank you for all that you do.
Thank you
very much.
Yeah, but then we have the negligent ones. We have the medical practitioners that are not very nice. We have the medical practitioners that are just very laissez-faire and lackadaisical when it has to do with their work. But who do we report to? Who do we talk to? I am coming from a far distance to get professional healthcare service. But then I get there and then you're yelling at me, or you're telling me to move to one side, or you're not even attending to me the way that you should.
Yeah.
So who do I talk to? Who am I reporting to? Especially now, we were mentioning something that there's a difference between a general hospital and then a private hospital.
Private hospital, yeah.
Either general or private, we need healthcare. We have a healthcare system that we're going and we are paying for. So who are we talking to? Who am I telling that, okay, so this particular nurse is yelling at me or is not treating me correctly? If sometimes I know that I talk to a doctor and the doctor is probably the same thing too. So, Bashi, who are we talking to? Who do we report to? What do we do? How can it be corrected?
That's like a very, very big question again, I mean, because things like this lead to like errors, in malpractice and all of that. So it's actually a very big thing. But not trying to make excuses for people, I would just say that in general, as humans, we're prone to mistakes, we're prone to errors, and as healthcare workers, we're not superhumans. Even though people expect us to be superhumans, they expect us not to make any error, any mistake. They expect you to be nice all the time, forgetting that you have your own baggages that you're dealing with, even though that's not an excuse for you to attend to a patient anyhow, but still, people should put that at the back of their minds that, firstly, these doctors, nurses, lab technicians, they are humans just like them, So, yes, you have your expectations from them as well too, but, you also have to just give them or make slight excuses for them. So now when you have those ones that, go overboard, sometimes, because like I said, there's no excuse for a doctor, a nurse, a lab attendant, anyone to just behave anyhow to their patients, talk to their patients anyhow, attend to them in any particular way or in a laissez-faire manner as you described, So when these kind of things happen, you visit healthcare hospitals, most times you usually have helplines.
Okay.
Yes. So you can just request, because whoever is going to be attending to that will most likely not be the next doctor or the next nurse that is beside that person. But another thing that you can do is, if it's going out of hand, you cannot find a helpline, because when you walk into the hospital, you are not going there thinking that, something is going to happen. I'm going to have this challenge or issue with this doctor, So when you get there, you can speak to any other person. Most times, if someone is a healthcare worker, if he's a doctor, a nurse, or this or that, So you can just request, so excuse me, please, I would like to see the senior doctor in this place, Talk to someone else, They don't even know why you're asking, and you speak to the senior doctor. I'm very sure that they will take it from there, or a senior nursing officer, or whoever it is, But like I said, we're humans. These things happen. I can't tell you that these kind of things don't happen in the hospital. It happens a lot. I've seen, in fact, sometimes, I've had to step in and, try to just speak to both parties and all. Sometimes patients are funny as well, too. I don't want to speak ill of my patients, but they can be very funny at times, too. They have too much expectations. They walk into the hospital, they say they have a headache, and they want to feel better, like, immediately, So this kind of thing to also affect or, agitates some people. Like, we have different doctors are humans again. You had different doctors with different characters, which they definitely are going to bring to the workplace. You know, there are certain characters that you can't just leave at home. You know, some people are less patient. They're not as patient as others.
Okay.
You have some doctors that, you know, people talk anyhow to, speak anyhow to, and all, but, you know, they're very patient, you know. They just keep shaking their head or saying, no, I'm sorry, man. Or, and some don't even want to hear, they just walk out, you know. So you have different people with different characters. But ultimately, if you visit a healthcare facility, you do not feel comfortable with the way you were treated or the quality of care that you got, then please, by all means, because that's one of the ways to minimize errors in practice as well, to reporting, letting people know these things are actually dealt with.
Yeah.
All right.
Thank you very much for a very eye-opening interview this morning, a conversation.
Yes.
I've actually learned a lot.
A whole lot, in fact.
Somehow, I'm now sympathizing a lot more with healthcare providers based on the conversation that we've had. It's not an easy job.
It's not easy, trust me. Sometimes the patient load is even a lot. One doctor is seeing how many patients. We are humans too, you know, and people will expect you to be all smiley. Yes, we try to do that, you know, but sometimes you are tired.
Yeah, exactly.
When you're fatigued, you know. So also in healthcare systems, you have supervisors, you know, even senior doctors and all of that. So that's why they are there as well too. They're also there to identify certain issues, you know, because some doctors might be going through certain problems and all, and it starts to reflect their character, the way they behave at work. So it's your duty as a supervisor, a senior healthcare officer, to be able to identify that and try to address those issues. Like I said, doctors are human. Some doctors abuse alcohol as well too, you know. So that's why you have supervision in a proper healthcare facility.
Right.
Thank you so much, Dr. Rihanna Tawabo, for joining us this morning. We've been able to tap from your wealth of knowledge, and we hope when we call you again, you would definitely join us.
Certainly.